Hi, I'm Megan. I'm a nursing instructor with the Annie Taylor D School of Nursing at Weber State University. So how is sepsis diagnosed? Healthcare providers use a combination of signs and symptoms and blood tests to diagnose sepsis. Additional tests may also be needed, such as urine tests, chest x-rays, CT scans, and ultrasounds. Signs and symptoms that indicate sepsis could be present include fever, fast heart rate, rapid breathing, confusion, drowsiness, severe weakness, low blood pressure, and cool and clammy skin. Blood tests performed may include a white blood cell count, which will typically be high when an infection is present. Kidney and liver function tests may be obtained to determine if organ damage is occurring. Lactic acid levels are often checked. When a lactic acid level increases, this indicates that sepsis is worsening. Blood cultures may also be checked to determine appropriate antibiotics for treating the infection. The next step is to determine, if possible, where the source of infection is so that it can be appropriately treated. So what are best practices for treating sepsis? Early medical intervention is necessary to have the best outcomes in treating sepsis. Giving antibiotics as soon as possible will help to treat the infection causing the sepsis. These antibiotics are typically given through an IV. Culture and sensitivities are done to determine what microorganisms are causing the infection. IV fluids are often necessary to help keep the blood pressure from dropping dangerously low. If blood pressure drops too low, vital organs are not able to get enough blood and oxygen, which can result in organ failure. Oxygen or ventilators may also be necessary to help if the lungs are not providing enough adequate oxygenation for the body. If the kidneys are injured from lack of oxygen, dialysis may be needed. Other medical treatments are often used to prevent complications from sepsis. Individuals experiencing sepsis need to be closely monitored in the hospital and will often be in the ICU setting. Is sepsis preventable? Sepsis may not be preventable in all cases, but because the cause of sepsis is an infection, measures to reduce the risk of infection can help to decrease the risk of sepsis occurring. Ways to decrease the risk of infection include good hygiene, such as frequent hand washing. Keeping cuts and wounds clean and covering them with a bandage can help to prevent these from becoming infected. Staying up to date on vaccinations can also help to decrease the risk of infection. Chronic medical conditions such as diabetes, kidney disease, heart disease, lung disease, or a weakened immune system can increase the risk for infection. Individuals with these medical conditions should take any medications as prescribed, and they should follow up regularly with their provider to ensure their condition is well managed. Recognizing the signs and symptoms of sepsis is important so that early treatment can be initiated if sepsis is present. Recognizing and treating sepsis early can help to decrease the severity of the condition and improve outcomes for patients.